It's hard to believe a year ago today I was on the House floor speaking about the coronavirus. And this same week my parents are going to get their first vaccinations. I actually started reading about this on January 6, 2020, over a year ago. With more than 4,500 people confirmed infected in China and over 100 deaths, the coronavirus certainly has my attention. After reaching out to the CDC and the Kansas Department of Health and just warning them that I thought this was going to be really bad, I started reaching out to the FDA and to private enterprise saying, look, we're going to need more testing, we're going to need more therapeutic agents, and for sure we're going to need a vaccine. And I'm just so proud of this great American effort to accomplish all of this. You know, way back in February and March, not knowing exactly how this was transmitted, but doctors and nurses on the front line, just so concerned about it, and working hard and taking care of people. And even myself, I put my sports coats away and my tie away, broke out some scrubs and found a stethoscope and a lab coat, and went to work in Kansas City.
Some lawmakers are even busier on the front lines of battling the virus, like GOP Congressman, who also happens to be a doctor, Roger Marshall of Kansas.
And the ER doctor, the ICU doctors telling me they were running out of ventilators. So we reached out to the White House and said, we're out of ventilators. We have 13 people up here, and we just don't have any ventilators left. Less than 48 hours later, 2 Black Hawk helicopters with 4 ventilators showing up on the front lawn of Southwest Medical Center. It was just a great sight to see. We'll do whatever we need to do to make sure that we can accommodate the situation. You know, as part of the Doc Caucus, we were constantly assessing the situation, making sure that the FDA was given prompt attention to the new therapeutics out there, the new antiviral agents, as well as the new monoclonal antibodies. Let doctors make the decisions who they think would benefit from the most, whatever we need to do to get government out of the way, and let the doctors make the decisions, that doctor-patient relationship. So we were out there making sure that all the testing, all the new tests that were coming online, were getting their attention as well and getting them approved in an efficient fashion. And then lastly, we paid very close attention to the development of a new vaccine. I remember thinking back in last April or May that we could have a vaccine ready by Thanksgiving time. And so many people told me, and especially the national media, told me that was impossible. Usually it takes 7 years to get a vaccine. So President Trump is not going to be satisfied unless we have a vaccine ready this winter. We didn't have just one vaccine ready by Thanksgiving, we had 2. When the front page is going to be talking about the impeachment, we need to be talking about how do we get vaccinations in people's arms, how do we get this economy going. Even just within this past week, we're vaccinating over 1 million people per day, 1.6 million people actually just last week in one day alone. We're well on our way. It's been an incredibly tough time. We've lost 400,000 Americans, mental health issues, suicides, substance abuse, all those things have gone up. It's just been tough times, but America's going to make it through this.